Hello everybody, good day to you. My name is Oye from Sickle Cell Convos. So this will be the 6th video in the series where I'm discussing important things when living with sickle cell. So for this one, I want to discuss early presentation. When you live with sickle cell anemia, it is very important to present early to the hospital. A lot of these complications can go south very, very fast, So the doctors can only help you if you speak up early. If it is too late when the person presents, there's nothing much the doctors can do. They will try their best, but sometimes it's just too late, If you have pain, remember that pain is an indication that there's something wrong somewhere. So there's some pain that you have and you can, if you rest, you use your eat pad, you use your medication, you're okay. But if you notice that you have persistent pain in a particular area for a prolonged period of time, you've used your medications, you're well hydrated, you've used your eat pad, you've used your balms, you've used everything, and it's still the same thing. It goes and it comes, it goes and it comes, and it's still at the same spot for months. You need to go to the hospital. Some people say, oh, I've had a particular pain somewhere, maybe my shoulder or my knee. I've been experiencing it for 6 months now, 6 months, and you've not gone to the hospital. The doctors have not requested for an X-ray or MRI. That's not good enough. That's not good enough, because the earlier they find these things, the earlier they can place you on medication, the earlier they can do their interventions. Remember again that there are some complications that go negative very, very fast. If you have a sickle cell warrior that the oxygen suddenly drops, the person is breathless, the HB, hemoglobin levels, or the PCV, as some people call it, drops, it is an emergency. They need to be fast. It could be a case of acute chest syndrome, it could be hemolytic crisis, it could be anything. But when it is too late, and the person presents when it's too late, there's really nothing much that the doctors can do. So it's very important that you present early to the hospital. Prevention, they say, is better than cure. So if you've noticed that you've done something right and that pain or that breathlessness or that pain in the chest persists, please go to the hospital. Even if your doctors don't say, you can suggest to them that you want to do more checks. You want to be on the safe side. You want to do, can you please send me for an MRI, or can you please request X-ray? I want to be sure that everything is going well. So please do that. The doctors would only help you when you speak up. They wouldn't know if you don't speak up. So please do that. Remember that at the back of your head, you always want to be there. If something goes the same way for 3, 4, 5 days, you've been feeling the same way, nothing is helping, it's time to go to the hospital. Until I come your way next time, I remain Oye from Sickle Cell Convos. Please follow me on all my social media platforms, and I will see you next time. Take care, stay blessed. Bye-bye.